Now, I'm not a doctor, so I'm going to try to stay in my lane, but I want to set down a counter-narrative. I want to posit that the media's current nature of coverage of the opioid crisis does nothing but exacerbate the crisis itself. Now, how is the media doing this? Well, at its core, we have a simple supply problem. If you look at a graph of opioid overdoses between 2000 and today, you'll see an uptick right around 2008, 2009, 2010, and then it starts to really spike. And you'll see it track relatively well to how often the media covers opioid overdoses. So that in itself is interesting, right? What's the correlation there? Well, I think there's a decent argument to be made that as the media covers an opioid crisis and says it's an epidemic and that people are dying of opioid overdoses, it gets people a little scared. It gets people in medicine a little scared. In fact, you'll see there's been a decrease in the amount of painkillers prescribed. I want to take a macro view. I don't care whether they're prescribed illegitimately or legitimately. Simply that the total number of painkiller prescriptions have gone down. As that number dwindles, the supply dwindles. And as the supply dwindles, there's still a demand for it, whether illegitimately or legitimately. And as that demand remains the same, that demand then shifts from perhaps pharmaceuticals and doctors to the streets. I'm going to use streets in a broad term here, saying drugs that are manufactured in a way that are not controlled by pharmacies, right? And when third-party or illicit manufacturers develop, they're going to try to develop the most cost-effective supply to that demand. And really, at the moment, the most cost-effective supply to that demand is something called fentanyl, because fentanyl is hyper-potent and it operates in micrograms rather than milligrams. You can make more of it and sell less of it for the same price, right? But at the same time, because it's hyperpotent, it's much easier to lethally overdose on it. But now, historically, if you say, let's say 1850, and you're talking about opium and opium smoking opium plants or pipes, or you take the early 1900s with heroin or morphine, it's not quite as easy to lethally overdose on this. The amount you must consume is just higher. During that time, we're talking about grams. Now, as the pharmaceutical industry developed in the 50s, 60s, 70s, 80s, you saw the development of milligrams, and therefore a smaller dose could be more potent. And you saw a rise in overdoses charting the potency amount in grams relative to the intake. Think about it like alcohol. Alcohol is a depressant like opioids. It slows the heart rate and can cause overdose and death. The difference is you have to consume a lot of alcohol because alcohol in and of itself isn't very potent, and just a beer or a wine, the most potent form you have really is, liquor, right? 80 proof vodka. You still have to consume quite a few shots of vodka before you get to a, emergency level where you're getting your stomach pumped at the hospital. And it's not as easy to do. It's not like where you just have a sip of vodka and whoops, 4 minutes later, your heart's at 20 beats per minute. So at its core, what we have is a super high potency problem of opioids. Now there's a catch to this, in that we actually have an antidote for opioids. It's called Narcan, or naloxone. Now, Narcan rips the opioid receptors off of the brain and can reverse overdose like this. It can accelerate the heartbeat back up and can save people. And when you're dealing with, let's say, morphine or standard semi-synthetic opioids like prescription painkillers, because you're dealing in a milligram level rather than a microgram level, people have to consume quite a few, let's say, relative to, an infinitesimally small dose. Even with pills, they're put together with binders and Tylenol and ibuprofen that somebody has to take, 12, 15, and then that metabolism rate is slowed down with all that you've consumed, that it takes a little bit of time before that overdose really hits in and sets. And if a lethal overdose is going to take 75 minutes before it's fully metabolized in the liver, that gives an emergency response team much more time to react, show up on the scene, and inject Narcan than, say, 2 micrograms, which is then ingested and metabolized like this through the blood-brain barrier, and then there's no time for an emergency response team to respond. They can't get there in time to administer Narcan. The person's heartbeat is already slowed to the point of death. Now, where does media play into this? Well, media plays into this because what it's done is it's forced the supply chain of opioids that we can combat in a reasonable way in hospitals and with doctors and emergency response teams, like semi-synthetic opioids, like prescription painkillers, to shift. As that supply chain goes down, people turn to the black market. The black market is willing to generate fentanyl, which is hyperpotent, and we don't have a good way of combating that because it's so strong and acts so quickly, or such a small dose, that our response time as a society isn't very good. And also because fentanyl is more powerful than, say, just standard morphine or standard, semi-synthetic opioids that would be prescribed, sometimes you have to administer more than 1 shot of Narcan. And all these culminate with just more overdoses. we're not able to treat overdoses as effectively as we used to be able to. And so you see, as the media continues to amplify the opioid crisis, people get more scared, pharmacies and doctors clamp down further, tighter on the prescriptions. There's less prescriptions, less normal opioids that have a longer response time that we can handle. More people turn to the market, more people consume fentanyl or other derivatives that act fast and can be lethal at very small amounts that we don't have a good way of combating. And so the media creates this kind of positive feedback loop. And when I mean positive, I don't mean it in like, oh, happy way. I mean positive feedback loop in the R squared exponential way. And that as the media further, promulgates the idea that we have an opioid problem, people want to combat it by stop prescribing opiates and cutting down the supply chain, but that demand still exists. And that demand is being filled by more potent and more potent and more potent opioids that we as a society don't have a good way of combating, just in terms of, dose and gram levels. Now, where are the op-eds on this? Where are the research papers on this? I don't really see very much. All I see is media talking about how we have a problem and it must be solved and too many people are doing opioids and we must build a wall to stop the flow of drugs. That doesn't do anything. The problem is much more insidious, because when you have pure synthetic opioids that can be just manufactured, like fentanyl, even then, let's say you illegalize fentanyl. You make it a Schedule I drug. It's like playing a whack-a-mole. There will always be an almost infinite derivatives of synthetic opioids that a government can never respond fast enough, right? There was just recently, I think, a report of 3 people dying of acrafentanyl, which is a very potent derivative of fentanyl itself that nobody had ever heard of. It was just doing a molecule derivative of fentanyl that wasn't illegal until some people died of it. And even then, they weren't sure what the people had died of because they were dealing in such a small dose, nanograms per milliliter, that the toxicology reports had to go looking and test very specific derivatives of just pharmacy grade, laboratory grade drugs to determine what these people had actually died of. And so as the DEA or the government legislates, this derivative of fentanyl is illegal, or this derivative of whatever, some synthetic or semi-synthetic opioid is illegal, another one will take its place. There is an infinite array of derivatives of synthetic drugs you can make that the government just cannot legislate in any meaningful way. Ideally, I wish the media would take a more nuanced and perspective view on the opioid crisis and think about its root causes and its positive feedback loops, especially as it should have learned from the crack epidemic that I think it helped promote in the 1980s. Anyway, that's just a thought for you guys this morning. Hope you guys have a good one. If you want to watch another video, you can click around here. Thank you.